Welcome to P Passionate W World, R Radio N Network, LLC, a multimedia company. Ann Arbor, Michigan, Boston, Massachusetts, Liverpool, England, Melrose, Florida, Los Angeles, California, Fullerton, California, Washington, D.C., Chicago, Illinois are one of the many broadcast homes of PWRN, a multimedia company. The world in your hands. And now, without further ado, let me present to you one of our many hosts and their programs.
Welcome to the Energy Stoners Cafe. My name is Toni Quest, and I'm really happy that you're here. I like to interview the most interesting people I can find on the planet. So grab a cup of coffee, sit down, relax, and listen. You're going to find that these guests are so intriguing, you'll wonder why you didn't know about them before. We're back at the Energy Stoners Cafe, everybody. Thanks for coming to the show. And I have a repeat guest that's going to do a follow-up with us. It's Dr. Robert Clark from Augusta, Georgia, and he is with the Center for Primary Care. We're going to talk to Dr. Clark again because things have changed since our last interview, and I just want to follow up with him because he seems to be on the front lines in his way, and here we go again with him. And I think everybody that's involved in this particular podcast right now, we're all alive and healthy, I can report, and I think a lot of it has to do with our self-isolation and our social distancing. So welcome back, Bob.
Oh, thank you. It's good to be back.
It's good to hear your voice.
Yeah, I'll have to say is that I know you guys are under a lot of stress. Where you're at is like the hotbed of the COVID epidemic, and you guys are really taking the real brunt of this epidemic. You know, when you think about it, I don't know if you guys have looked at the numbers or not, but between New York, I mean, you guys have New York State, I think you guys have like 30% of all the cases in the whole country.
Yes.
About almost 40% of all the deaths in the country.
Yeah, it's very unsettling to say the least.
You guys have really had a tough time.
It's hard because we know people personally who are suffering from it right now in some cases, and a number of people have passed away from this. Some merchant in the neighborhood, like the person who owned the sort of like the big local grocery store, the whole family.
Wow.
You don't even really know how to feel.
Sure.
And things have changed in that when we spoke last time, there weren't enough masks to go around. Basically, I'd say 6 or 7 weeks ago, you had talked about a mask being a good thing, but the problem is that when you constantly touch your face,
yes,
your hands are touching your face and you're very close to your nose, your eyes.
That's right. You guys have been wearing masks up there. Have you noticed that that's what you've been doing?
Yes. We took them off just to do this interview. I think that the law is written right now that we can't leave the house without one. I just also want to share and get your take on this. It's that many of us, because we're really being encouraged to stay home and not go out. They're doing TV commercials telling us to stay home. But every now and then we have to go out. You have to go to the grocery store. And I'll say that I got my first grocery delivery today.
Oh, wow.
Yes. And the young lady came to the door and I told her to leave the groceries at the bottom of the stairs. I hope I did the right thing rather than have her bring them all the way up to my door.
I'll say this about social distancing first. That's the easiest one. We started all this lockdown in the country based for the reason for healthcare to catch up. And that's what the issue is that the availability of healthcare resources in your community, can they help if you're really, really sick? And your area, unfortunately, is still under-resourced. There's plenty of websites you can go, but if you just go to the Washington State website, and you can look at that, look at the data, if you're a data-driven person like myself, but you can really see that the state of New York, New Jersey, and Massachusetts, the resources, you guys are beyond your max of all total resources. So you got to keep your social distancing in order for the healthcare to catch up. That's really important for your guys' area. Absolutely. Washing your hands is still going to be the biggest deal. Mm-hmm. You've been taking your vitamin D, right?
Yes, I have.
It's real important. Really important. That's really all that you really can do.
And I find that also in the stores, like the pharmacies, even in the local Walmart, which is open, and I've opted to go early in the morning because I was helping a neighbor get some things that he needed. I went very early in the morning when they first opened because I understand that they clean the place from top to bottom every single night, at least the one near me. So I felt maybe perhaps that's the safest place.
Any place where you're going to go where there's not a lot of congestion. And that's going to be key for a long time. This is not going away. It's going to go down, and it's not going to be as prevalent. But it's not going to completely go away. I would definitely not plan on being in a very congested type place, for sure.
I noticed that one of the local merchants here, she owns one of the local liquor stores. She sits at the front desk at the counter with a mask and gloves every day, all day. And she has a sign on the door that says only 2 people are allowed in at once. And sometimes she gets a little bit of pushback on that. There are people that still don't believe that this is real. She has to actually go to other means to get people to leave the store. As you might imagine, she's not hurting for business these days.
Liquor sells,
Yes,
if you don't have anything else to do, I want to get liquored up. But she's doing the right thing, and people should respect her safety and the safety of all the other customers. Absolutely. You don't want to have that many people coming in at one time. I mean, she has to protect herself. And that's really an important aspect for her. Absolutely.
Very much so. There are a few people that actually respect, and they won't even go in the store. They'll call from outside the door and say, this is what I want, and she'll open the door and hand it to them. There's some people that are very considerate. But I got to ask you this question. What would you say about going back to work? I'll share. I'm basically an independent contractor, basically, as an artist and a sole proprietor, but I had a little part-time job, 1 shift a week. And there was an incident at this job as I was sitting at the front desk for this place, and there was someone that came in that wasn't supposed to come in, did not have a mask on. I had a mask on, and they had us wearing gloves as well, but it was very disrespectful. And I asked her why she was coming in without a mask. And she said, well, because I don't have one. If I could get one, I would get it. And I said, why don't you do what you have to do outside the door? And then I decided, I made a conscious decision because of an autoimmune disease. I made a conscious decision not to go back there until this thing really dies out, until the curve is very much flattened. I hope I made the right decision.
At least for my patients, and I can comment on my patients that I've recommended, is that we are saying that, look, by June, it'd probably be okay in our state for all of our patients who have cancer, on immunosuppressant drugs, those kind of things, to do more activities like that. So if you're immunosuppressed, then no, you shouldn't be. This is not your time, especially in New York. Yeah, no, you wouldn't be doing that. I mean, Georgia's different. We're in a different circumstance than where you're at. Absolutely. No, you can't do that.
I understand they opened your state and people can go and get their hair done now and get haircuts.
Anything like that is on news media, and then there's reality, right? The governor of Georgia said bowling alleys and hairdressers and
bowling alleys
and tattoo parlors can open up.
What?
And so that's a big joke around. But the reason why the governors had to name those things is because in his original order, they know how politics are. You have to be very specific. And so in his original order for them to shut down, he listed them as part of the ones that had to shut down. And so in order to open up, you have to relist the ones if you can open up or not. That's part of the funny part about it. But if you want to be one, you have to only have 2 people in the room. You have to have a mask on. You have to have a whole list of cleaning procedures that you have to abide by. And if you don't, then you lose your license. It's not a tutorial. It's in the order. So actually a couple of places have actually been shut down who thought it was a free-for-all.
Oh.
And they came and they took their license.
Wow.
Yes, the governor said, yes, you can open as long as you're complying with a very specific rules of governance, of cleaning, only having so many people in your place. If you're an appointment, you can have the appointment sit in the car, and then they come one at a time, those kind of things. So that's what he said in his order. But we'll see in Miss Georgia if it worked or not. Probably find out next week. We'll watch the cases and see how they do and kind of go from there.
So for somebody that wants to go back to work, what do they need to know about going back to work? Like, how do you know if it's okay for you to go back to your job?
I would just say it depends on your own personal immune status.
Let's say someone has rheumatoid arthritis, that's autoimmune, lupus, multiple sclerosis, that's an autoimmune as opposed to immune suppressed.
So if you have rheumatoid arthritis and let's say you're on an immunosuppressant, let's say you're on methotrexate, you're on an immunosuppressant. So you're already at risk of viral infections. You're already at risk of pneumonias. You're already at risk for those things. So it wouldn't be cool to go back to work in a public area. It wouldn't be good. You're at a higher risk already. So you would continue to do, if you could do it work at home, that probably would be your best bet.
It's interesting, even in your own home, I find that being isolated most of the time, it's like I really haven't had a visitor. I felt compelled to sort of deep clean my own space. That's clean, but I did this deep cleaning, like every nook and cranny in my living area. This is a question. Can people carry the virus in on their feet and on their shoes and things like that? Can they do that?
Of course they can. But that's not really the real question that you're really asking. The real question is that infected or not? So let's pick a disease that you might know about, which is HIV.
I've heard of that.
Okay, so that's a virus. Can you get HIV from someone's tears who's HIV infected? The answer is no. We know that. But is there HIV virus in their tears? Absolutely there is. But it's not enough to cause an infection. Is there HIV virus in a person's who pees and urine? Yeah, of course. But it's not enough to cause an infection for another person. So for those of you or your listeners who are old enough to remember the HIV scare in the 80s, there was all kinds of things going on with HIV with regards to, oh my gosh, if I touch someone, if they breathe on me, I'll get HIV. Oh, if they cry on me, or if they kiss me, I'll get HIV.
If they sneeze.
Oh, yeah, all these things were with HIV. But what you find out is that there's a certain amount of a viral load that you must have in order to get an infection. So in HIV, it's blood and it's semen. But with COVID, we don't know what the viral load is yet. It's only been, 150 days now. So no, we don't know what the total viral load is. So you'll get all kinds of cultures. They'll say, well, we picked it up on shoes. We've picked it up on plastic. We've picked it up in the air on Mars, but it doesn't mean that that's going to cause an infection. You have to find out what the load is or the load of a virus that needed to cause another person to be infected. And so we don't know that yet.
Well, we do know that if you have a big crowd together, recently you might have seen it in the news that a bunch of people were actually disbanded and 1,000 people showed up in Manhattan. I wasn't there. I wasn't at that one. Okay. But 1,000 people showed up. The mayor of New York City got on and talked about it in detail and why he shut that down. And it wasn't done because of any kind of religious or racial discrimination. It was because he was trying to protect a whole population.
Absolutely. I'll tell you a story about one of the worst places in the country that really didn't get as much news because everyone concentrated in New York, rightfully so. But one of the worst locations in the country, and actually at one time worse than New York, was Albany, Georgia. Albany, Georgia is rural, very rural. And their death rate was higher than New York. Infection rate per population was higher than New York's. It was so bad in Albany, Georgia, they had to call out the National Guard and quarantine the whole area, 4 counties worth. But it all started because they had a massive funeral So there was this very prominent person in Albany who died, and it was a very tight community. There's only about 100,000 people in that county. And they had several thousand people at the funeral. And somebody had COVID there, a couple people had COVID there, and infected a lot of people. And it can happen. So it's not a thing to play with.
It's so contagious that it sounds like it's more contagious than HIV.
But it's R0 is still not as contagious as, let's say, measles, not as contagious as chickenpox.
Chickenpox. That's the herpes zoster, right?
Correct. Well, yes, chickenpox that changes into herpes zoster. So it's not as contagious as those infections, but it is more contagious than influenza. I think the R0 is 1 to 1.4 of influenza, and COVID is 1.9 or something along that line. The R0 being that for every one person that has it, how many people can you infect?
I saw something on TV that said that for COVID, for every one person that has it, they'll infect 3.
I don't know if that's true. I'll have to look at that one. I don't think it's that high.
Okay, well, that's good to know.
I don't think it's that high, but we'll look.
Yeah, the only way to know is to see what the numbers really are. So we have a canary in the coal mine in this thing. Who's the canary in the coal mine in terms of a demographic? Because I hear a lot of African American people are dying. A lot of Latino people are dying.
When you think about all diseases, and you're going to talk about social definitions, because race is a social construct. Any society has a social construct that you're the lower person. You're going to have more disease. You're going to have more diabetes. You're going to have more hypertension. You're going to have more cancer. You're going to have more of those diseases. And that's the same that you saw in Asia. For their minority population, they had a higher risk of COVID. And that's because of immunity, whatever your immune status is. So if you have a lot more diseases, then your immune status is lower. And so you're going to have a higher rate of infection. Well, that's what's happened. So you got to have a lot more obesity in that area. So thereby, when you have obesity, you're going to have lower immune system. So thereby, you'll have a higher rate of complications.
What can someone do to actually protect themselves outside of taking vitamin C and social distancing? And if you could find zinc in the store, I've been inclined to buy a lot of things online because you go into the store and it's just not there.
If you're thinking about immunity, let's go over some major rumors and some things that have been going on. So if you want to boost your immunity, one thing you have to remember is you got to have a good vitamin D level. And I mentioned this, I think, last time.
You did.
And the reason why I'll mention it again is because a lot of African American people have low vitamin D. Vitamin D has come from the sun. So when you have more melanocytes in your skin, you need more sunlight exposure for your body to convert to vitamin D. But vitamin D starts your immune system, helps your immune system start. It's not going to protect you from getting it, but if you do get it, your immune system will be raring to go. It'll be ready to go.
So vitamin D is like the ignition.
No, it's like your gas.
Oh, it's beyond. Okay.
Think of like your immune system like your car or like a Ferrari. You can have the most great Ferrari ever, but if you only have a half a tank of gas, it's not going to go very far. But it's not about boosting. It's not about loading up. It's about a constant level, just like for your car. You don't just put 1 gallon in and say, okay, we're good forever. No, it doesn't work that way. So you always got to use your immune system, right? So it's always protected.
So your body will naturally deplete itself of vitamin D. That's a good thing to know.
So that's a constant all the time. The other thing you mentioned zinc. Zinc decreases your virus for common cold, which is a milder coronavirus. It decreases your infection rate when you have it by a couple days. So it decreases your for a common cold. But we don't know about COVID. You can take it, but I don't know if it's going to help you or hurt you. I have no idea.
I like the fact that when you say you don't know, I'm glad that you say that, because a lot of people, I've been occasionally turn on the TV and I hear some crazy things, like people are injecting disinfectant or Lysol.
Well, we have very prominent people who give lots of medical advice on TV. So you don't listen to those people because they don't know. They're not practicing doctors. They're not seeing people. They're not taking care of anyone. So we'll skip over that guy. So
okay,
there's something that you might not know. You might not have heard of. It's always interesting. It's something called forest bathing.
Forest bathing. So I have to go out in the woods and take a bath out there in the stream?
There's something called forest bathing that actually has been shown in some good studies as far as increasing a person's immunity. That's actually a pretty hot topic in actually Asia over the last several years, where they noticed that people's what they call HHNK cells increase if they do something in the forest, like walk every day in the forest, a very particular type of forest. And they think it has to do with trees.
And the oxygen that they put out?
No, it's actually a particular type of hormone that they put out to protect themselves against insects. We find that when a human being goes through there for a couple days, that they actually boost their own immunity that lasts for 30 days. That's what a couple actually repeat studies, very interesting studies, have gone on with regards to forest bathing. So if you're ever interested in that kind of a topic, you can look that up on very fascinating forest bathing. So that's pretty cool things.
It sounds very pleasant.
Yeah, it is. And so the other thing that you can do that actually it's semi-controversial, but it has some basis on it, is the hot, cold showers. A lot of the Scandinavian countries and some of the Asian countries, they practice kind of bathing where you go in real hot water, then you come back and jump into real cold water. And that has been studied for for 5, 6, 8 years. I've been looking at that. And that actually has been shown to increase a person's immunity. And so a good way to do it is what you would do is 3 minutes of hot shower, followed by a minute of cold, then another 3 minutes of hot, followed by another minute of cold, followed by another hot, another minute of cold, and then you're done.
You got to do the cold last? You can't do the hot last?
Yeah, cold last. That's right. And so that triggers your immune system, and that's been shown in multiple studies. And that's what they do in a lot of Scandinavian countries and Asian countries. So kind of boost a person's immune system to help them. And that's a routine thing that they do all the time.
Well, I used to live at a place. They had a lifestyle center, almost like a mini spa. And people would go into this sauna. I don't really care for sauna. It's just so hot in there. But they would do is they'd come outside. It's winter and they'd be standing out there. I would walk by and I always tell the people, I say, you need to get back in the house. It's too cold out here for this. Are you crazy? And
that's what they do. They do those real hot saunas. Then they jump in cold water. Then they go back in the hot sauna. Yeah. What they studied was, they said, hey, people who have done that in those countries, what are their overall infection rates? And they noticed that their infection rates are pretty lower. And they started studying those kind of things and doing some good double-blinded studies. When you hear about these things, you have to look at whether things are double-blinded or not. As the president has said about one particular drug that unfortunately one person died from that I know of, healthcare is about double-blinded studies. And there's lots of conjecture out there, but until you're having solid studies, you really don't promote drugs and therapies. The ones I've mentioned, multiple studies have been done, and so it's not as crazy as others that I've seen out there.
I heard also something today, actually, that's called the population-based testing for getting people tested for COVID. I know that if you don't have any symptoms, and I'm just telling you what I've read, I'm not going to say that I know, it's just what I've read, is that if you have no symptoms, rather than overload and burden, especially here in New York, burden the healthcare system, if you have no symptoms, just stay safe, keep social distancing, and don't be begging for a test.
I will say this, one of the great tragedies when we go back and we look at this, what happened in the United States. And there are going to be a lot of pointing fingers. The one industry I will say that has totally failed us in the United States is the laboratory business. They have really ought to be ashamed of themselves in our country because they did not do what they were supposed to do. This is my 5th epidemic. And the other ones, I can tell you that every doctor and the other ones had tests that you could get if you were concerned. And then we could identify people who were sick and we were able to contain things. And I would say solely that they truly are the ones that are having a heavy burden on why it is the way it is. And so with that said, in Georgia, we actually, in our county, anyone who wants a test can get one, whether they have symptoms or not, because we have increased our testing. We were at the bottom 10th of all the states, and now we've moved up, and they've done well. But given the number of cases in New York, I would imagine that you are very similar to where we were in saying people, hey, look, if you don't have any symptoms, we don't have a lot of test kits. Quit asking. But it is a tragedy. I will tell you that it is a tragedy. And that being said, LabCorp, which is a national lab, finally, as of Monday, has been able to do antibody testing. So you might be able to get antibody testing, and they have more than enough capacity. They're a national lab. So if you have a clinician or someone that you can go to ask for antibody testing, they might be able to perform that.
This is like a 2-part question. We're going to try to make it one question. It seems that we are social distancing, and being a human animal as we are, there is especially for people that are not in a family right now or not attached to anybody, not married, single people. I'm wondering how it's going to affect the fact that we really haven't engaged. I haven't been hugged in months.
I had a patient the other day who came in the office and doing a normal exam, and then she was crying because she hadn't been touched. No one's touched her at all. And we're social beings, and there are consequences of this distancing. There are real consequences, and it's not always a good thing.
What are the consequences?
Well, you have people who are not going to the physicians when they're sick. These are the secondary causes of the pandemic. So we're mainly talking about COVID, but the real tragedy, the real problem is that people who have heart failure, they feel like they're short of breath and think it's also, I don't want to go because I might get sick. Or my sugar, I don't want to go. I don't want to do that. And they end up having strokes. And then you got your cancer treatments. You got people who are, I diagnosed a lady the other day with skin cancer. Her husband insisted that she came. She said, I didn't want to get sick, but I had to take it off. It was skin cancer. She could have waited. It would have been worse. But there are going to be real consequences. And so forget about, not just to minimize all the other things as far as people who are increased violence, increased depression, increased suicide. Those are real deals. And depression causes decreased immunity. So there you go.
What is one supposed to do about it? Because I know a lot of single people, including myself. I actually had a social distancing, like a social distance date last week. We made a very conscious effort to be outdoors. It was actually very nice, but sitting 10 feet apart.
I think if you could arrange for those even that, at least you're able to speak to someone, you're in a different environment, you're getting out of your apartment. I think those are important aspects. I know what the risks are. There are risks, but if you're washing your hands and you're keeping your social distance that way, I think your mental health is quite important also. And sometimes it might be at greater risk than actually the COVID.
Really? This is a stupid question, but I'm just curious. If I were to wash my hands and put on lots of hand sanitizer, and someone else were to do it too, would I be able to hug that person? Would it be safe?
I don't know I'll know that other person. So if they're not family members, technically the answer would be not a good idea. However, if you feel comfortable and you both wash your hands, says, okay, hey, we're washing all of our hands, we're all good, then you can give them a hug, sure.
I could put on a hazmat suit.
Yeah, put on a hazmat suit.
And hug.
Absolutely.
And
Absolutely.
Hug.
Yes, and hug. Put on a plastic shield. Put on a face shield. There you go. And then give a hug. There you go.
Spray the suit down, too, because I hear it lives on smooth surfaces.
All does it take? Is it infected or is it not? Who knows?
Yeah, you don't really know. I'm being halfway facetious when I say that. But I know that I've had some conversations with different people, and there's a tremendous level of frustration. I'm not talking about sexual frustration. I'm just talking about you just feel craving that human contact.
Oh, yeah.
Oh, my gosh.
Oh, yeah.
I love doing the video chats. People are like, I don't want to do that. I don't want to Skype. I don't want to Zoom. I don't want nothing. But I'll tell you something. There's something about doing a video chat with someone that you haven't seen for a long time, and all of a sudden there's their face, and you do feel something that happens inside of you when you're face to face with that person.
Absolutely. It's such an important fact. We are social beings. I mean, there's just no other way around it. And you need that social contact. You need that interaction to make you feel alive. Absolutely. That is very, very important.
Yeah. It sort of explains why all of the animal shelters, the dogs are being adopted. Single people are adopting dogs. I'm even considering it.
Well, yeah, because at least you have someone who's looking at you who's going to love on you.
Yeah.
Right? He's going to always be happy to see you.
I know.
I know.
Unconditional. I know. You walk in the room and you're like a celebrity. I remember my dog. I walked in the house from being out for some hours, and I was like a celebrity. We could talk about this forever, and I'm wondering if there's anything you want to close with, just to tell the audience, to give some reassurance about that we're going to be okay.
Oh, yes, this is going to be okay. I think what you'll see is as we do more and more testing, the numbers that are currently being shown are not going to be as high as far as death rates and those kind of things, because there's just going to be more testing. You'll find out more information. So it will be okay. It will be more than fine. This is not the end of the world by any stretch of the imagination.
From your lips to God's ears, Doctor.
Oh, no, it's not the end of the world. No. It's
not the end of the world. I know it's not.
No.
It isn't. No. Just keep distancing and keep washing your hands.
That's right.
I'll just say that from my experience, before we close this out, is that it's really important to, even if you have your mask on, people can't see all the time that you're smiling, but say hello.
Oh, yeah, you got to be kind.
Say hello.
Absolutely.
It's amazing how appreciated it is. As I see myself walking alone for exercise, and there are other people walking alone for exercise, and hello, how are you, how you doing, goes a really long way.
Oh, it does. It really does. And by the way, I just looked up R0. It's actually 2.5.
Oh, it's 2.5. Okay, yeah, because you did talk about R0 on the last show. So I think it might have been down from the other number. Yeah,
I don't think it's that high where you're quoting.
Well, we're all going to keep being careful, and you are just a complete comfort, Dr. Clark.
You have to be calm in these things, because if you're getting revved up, you're messing up your body. You have to be positive. You have to be outgoing. Those are things that help your overall body, your mind, your body, your spirit, your immune system. Those are all very, very important things. And so
that's true. There are a lot of things, and it's all encompassing, and going to have you back on again if you're willing, because, you really give such great information, and you're just such a warm, compassionate individual, and you are a physician, and not all physicians are so compassionate and warm.
I appreciate you saying that. Yeah, anytime, Toni, I'll be more than happy to come on in your show.
Oh, thank you. Okay, audience, it's a Center for Primary Care in Georgia, in Augusta, Georgia. And I'll say that Dr. Clark has definitely got a great bedside manner, and I appreciate you coming on the show. And the next time I'll also have more questions, because my questions never end. They only end when the director says, wrap it up. I really appreciate it so much, Bob, for coming on, and I know that our audience definitely appreciates it as well. Until the next time.
All right. Bye-bye.
Goodbye. All right, audience, I'll see you next time. Thank you so much for coming to listen to the Energy Stoners Cafe, and I always have great people on. I promise you that. The next one will be another one, and we'll hear from Dr. Clark again. And everybody, stay safe. Wash your hands and social distance, because it seems to be working so far. And I'll say goodbye. Thank you for listening to the Energy Stoners Cafe.
Thank you for listening to Passionate World Radio Network, a multimedia company. You can listen to this program all over again at passionateworldradionetwork.com, facebook.com/PWRN, twitter.com/PWRN, googleplus.com/PWRN. Distinguish yourself from the ordinary. And remember, please keep listening.